conditions of migrant workers and are urging them and their employers to get tested. To encourage migrant workers to get tested, the government has promised not to crack down on illegal migrants during testing. We must maintain vigilance until life gets back to normal. Follow all safety precautions to protect yourself and others around you. Overcoming COVID-19 together, let's all stick to the basics.
Thanks for being with us here on Arirang News. I'm Devin Whiting at the News Center, and it's now 4:40 p.m. Time for today's briefing from the South Korean health authorities. We should be getting updates on the latest case numbers and trends, as well as any changes to the distancing rules and the ongoing vaccine campaign. Today, we have heard that there were 456 new cases of COVID-19. It looks like the briefing's about to begin, so let's listen in.
And we will also be providing sign language translation. First, we will hear from Director General Son Young-rae about the countermeasures against COVID-19. I will start the regular briefing for Sunday, March 21st. As of midnight of today, there were 437 newly confirmed cases and there were 19 imported cases. Yesterday, 3 people passed away. We pay our respect to the deceased and we pay our condolences to the family members. Starting from March 14th to March 21st, there were some developments over the week, and I'll update you on the numbers. Over the past week, on a daily average, there were 460 newly confirmed cases. This is similar to 428 from the previous week. Reinfection level across the country was 1.04, and this was a slight decrease from the previous week. However, it is still at a number that is greater than 1. Regionally, there were 302 newly confirmed cases for the metropolitan area and 114 for the non-metropolitan area. For the non-metropolitan area, in Busan and Gyeongnam area, there were daily average newly confirmed cases of 53, and there are also problems happening in the public baths in Ulsan and etc. Those were the main causes. In terms of the trend of infection, mainly these came from family members and small gatherings, and also many infections were through business sites. We are seeing less cluster outbreaks in hospitals and long-term care facilities. However, we see an increase in the newly confirmed cases affected in multi-use facilities, including sports facilities, public baths, and the public institutions. In sum, from January to last week, over the past 9 weeks, we have seen 300 to 400 newly confirmed cases on a daily average, and this number is at a stagnant gridlock, and it is at a risk. And in the regions, we have seen cases, and we see a lot of the infection happening through daily activities, such as the use of multi-use facilities, and we do not see the trend of decrease. Right now, cluster outbreak is not decreasing in our daily lives, and we have to ensure that we see a decrease in that number and that this does not surge. Therefore, in order to do so, we ask our citizens to adhere to the measures on social distancing at all times. Now I will update you on some of the disease control measures. Until March 15th, in public baths, there were 1,200 newly confirmed cases of COVID-19 happening. For those public baths where cluster outbreak happened, these were areas where residents were registered as regular customers and have been using it often. Also, and overall, it was not really being ventilated in the right manner, and it was also cases where the masks were not being worn, and we believe that these were some root causes of the risk. And there were also customers who made use of public baths when they had symptoms of COVID-19, and this also seems to be a root cause as well. In order to minimize such risks, the government will strengthen measures on public baths. Starting tomorrow, for all the staff workers working in the public baths, COVID-19 testing will be carried out. And this is to prevent cluster outbreak that could happen in advance and to make sure that we can prevent it in advance. And also in order to make sure that there is no congestion, we're going to limit the number of people that are entering per certain area. And these public baths must post this in the front of their business site. And we also will make sure to stop the registration for regular customers as well. And we're also going to have mandatory QR code check-in and temperature testing before going into the public pass. For the users, if you have symptoms such as fever or coughing, please make sure to not use public baths and get tested instead. Especially when you're making use of public baths, make sure to use it for less than 1 hour. The longer you stay in public baths, the risk of getting the infection increases as well. And when you're taking your clothes off in the change rooms, please make sure to wear face masks and please make sure to refrain from talking to other people or eating inside. There are cases where people are making use of public baths because they don't have hot water at home, and there are also staff members such as the barbers who work within the public baths. Therefore, the government will not ban the opening of public baths, but instead we are making efforts to strengthen the measures so that we can work with these facilities instead. For the users and the managers of the facilities, we also want to ask you to adhere to the measures on social distancing and disease control so that we can curb COVID-19 together. Today's meeting on the Central Disaster and Safety Countermeasures Headquarters were held with local governments. There were discussions about the beach sites and the vacation sites, and this was especially the case for the Incheon area. And Incheon City is strengthening measures in that regard. For the Junggu area, it is sterilizing public washrooms once a day, and it is also carrying out special measures for the meal sites. And for the Ongjin-gun in the Incheon City, there are a lot of ships, and therefore temperature is being tested duly on the ports that go out and go in as well. And for the military personnel, these people are ensured to have been tested for the fever before they get to be boarding on the ships. And for the Gangwon-do Pyeongchang area, there was a case where a family of 10 members were all infected with COVID-19. Therefore, we had done testing. And considering that it is a very wide area, we also had the temporary hub screening sites so that residents could be conveniently accessing those. And by doing so, we were able to curb the spread of COVID-19 effectively. In Jeju Island, there was the Lighting Festival, which is a representative festival in the area. And this was successfully held with strict compliance to the disease control measures. We had the reservations that were received ahead of time, and we also had people stay in their cars, and many of the users strictly adhere to the disease control rules as well. We're going to hold the Central Disaster and Safety Countermeasures headquarters meetings, and we're going to gather opinions from the local sites, and we're going to make sure that we are strengthening measures focusing on each of the regional areas. It is getting warmer, and we are seeing the whiff of spring coming in. However, COVID-19 is still at a risky situation. We want to ask you to stay outside rather than staying inside, and we also want to ask you to have activities alone instead of with others. Please make sure to wear face masks anywhere at any time, and please make sure to keep a distance from others while making sure to wash your hands frequently. And if you have symptoms such as respiratory symptoms or fever, please make sure to get tested as soon as possible, and please refrain from visiting sites or facilities that are congested or confined. The government will also strive hard so that our citizens can return to their normal lives as soon as possible. Thank you.
네, 지금부터 질의응답 시간을 가지겠습니다.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.
As the weather warms and winter begins to thaw into spring, people are feeling reinvigorated and moving about more frequently. Though we all want to enjoy the warm weather with those around us, we cannot become lax with the risk of COVID-19 infection. Because cold symptoms are more common this time